Diabetes is a treatable chronic non-communicable condition in which the body is not able to metabolize sugar in the blood due to lack or inefficient use of insulin, a hormone that signals cells to take up blood sugar for energy metabolism. There are two types of diabetes. Type 1 diabetes is caused by insulin production failure that starts from childhood or early adulthood, while type 2 diabetes is caused by insulin resistance that occurs during adulthood.
The 3-4-50 concept: poor nutrition, physical inactivity, and tobacco use are causes of diabetes and lead to numerous deaths. The risk factors are having a family history of it, coming of age, being pre-diabetic, obese, and physically inactive. The U.S. had a prevalence rate of 11.3% in 2019. Minority groups at 47.9% were the most affected, with natives being at 14.5%. Men are more likely than women to have pre-diabetes, and 1 in 6 adolescents develop it. Factors associated with the problem are people being sedentary, unaware, uneducated, and/or obese.
The CDC has taken federal measures to reduce health disparities for people who live or are at risk for type 2 diabetes. The Division of Diabetes Translation has been created to provide information and opportunities to prevent and support those with diabetes through their unique cultures and traditions. The California Department of Public Health has also taken measures at a state level to prevent diabetes by promoting healthy eating, physical activity, less tobacco usage, and managing weight and obesity. They are also establishing lifestyle change programs to prevent complications for those in California who are diagnosed with type 2 diabetes. Blood sugar tests could screen for diabetes. One example is the glucose tolerance test, which measures glucose levels before while fasting and after drinking a high glucose drink. Type 1 and 2 diabetes could be treated through insulin, but type 2 could also be managed by weight loss, healthy eating, and blood sugar monitoring. Though insulin helps with managing diabetes, it is still overpriced and inaccessible to many.
The public can find information about diabetes online via the CDC, diabetes.org, or the WHO website. It's always encouraged to reach out to your primary care provider with any questions. People can seek care via their primary care provider if they have insurance, any hospital, or a low-cost community clinic, such as those found on websites like findahealthcenter.hrsa.gov.
Misconceptions about diabetes include that it can be caused by ingesting too much sugar, they need to limit carbs, or that they're more likely to get sick, which is not true, as long as they control their blood sugars, or that they can stop using insulin. These misconceptions can be dealt with primarily through education or recommendations to organizations such as the American Diabetes Association and Juvenile Diabetes Research Foundation,